हाँ, कर दी। हाँ। हम्म। होगी थी। हाँ। हेलो। પેલું તમારું જ છે. ગ્રીન ઓફિસમાં જઈને ચાલુ કરતા હો. જો આપણે આમાંથી જોઈએ એટલે બોલવાનું. અહીંયા તેનું નામ પૂછવાનું છે ને. જો તો બધે પૂરતી દેખાય ને. અંદર બેસવું નહીં. બેસીએ. હા એટલે અમે કરી માહિતી યસ ઓકે પહેલું સેશન માં તમારું ભાઈ એક હર્ષિતભાઈ નું છે ને હર્ષિતભાઈ નું છે પહેલા ત્રણ મારા ઓકે 1416 હા ભાઈ એમાં એવું છે કે જેને આવવાનું હતું ને એ નથી આવ્યા એટલે એનું નામ ખ્યાલ નથી તો રાખો છે લાસ્ટ યર આજે હા એટલે એમનું હતું નહીં પણ પછી સિનિયર કે નાસીને મેળ કરાવવાનું છે લાસ્ટ એટલે કઈ 19 સીધા આપણે જઈને કેમ ઓગણીસ ટોપિક છે પિતા મંદિર સીધા પતિકારણ છે એવી અસર છે કે નથી બધામાંથી અસર કરવી જોઈએ બોલો 70 460 4 8 હા
Hello, I am audible. So, good afternoon, everyone. Today's first lecture will be on study plan and project management. Will be taken by Dr. Vijay Sondarva. Dr. Vijay is SR in the Department of Preventive and Social Medicine.
So, good afternoon, everyone. Myself, Dr. Vijay Sondarva. I am a senior resident doctor at Government Medical College, Bhavnagar. So, today we are going to discuss about study plan and project management. So, why study plan and project management is important? For any study, it is very crucial that the amount of energy and time which is invested, which is not, it is not wasted. So, it is good to plan study in advance. So what we are going to discuss here is what we are going to discuss is to ensure that the our objectives are implemented properly. So the principles of project management, our objectives are to ensure that the defined objectives are met for management, to ensure that the products or deliverables are within our defined limits, defined timeframes and budget without compromising the quality of standards. So the end result should be provide direction for future implications and basically for the better tomorrow. So any kind of implementation process requires certain underlying principles and goals. For example, the process of resource allocation and management, the underlying principle is time management. So time management for any project is maybe too long or too short. So according to that, efficient and expedited progress to achieve the goal, time management is required. Another example is planning and scheduling activities. So here underlying principle is monitoring and supervision for reaching the goal with the best quality standards. Sometimes what happens, the researcher is very curious but confused in the starting that uh, he knows what he wants to study, but he don't know how to. So this kind of ad hoc approach to conducting a research study is often non-productive. The confusion at the beginning of study, like I want to do a study, but I am not clear about the objectives of my study. Confusion like I have prepared questionnaire, but I am not clear about the exact information I need. Or I will collect data, but I am not clear how to use that data. So this kind of confusion leads to haphazard collection of the data, and it will result in a disastrous end. Like I have data that are difficult to analyze. So data is already have you, but it is collected haphazardly, so difficult to analyze. Now you have analyzed data, but finding it difficult to interpret, and interpretation difficult, so the use of data is also difficult. So planning of any research project or project management, these are the steps which required. So first, researchers identify the needs of data of any kind of problem he's facing, he wants to do research on. So according to that, he will spell out the research question, and based on the research question, we will form the objectives, study objectives, and plan the analysis. After that, we will collect the data, prepare the data collection tool and collect the data. And after collection, analyze the data and draw the conclusion. So up to this conclusion, this is our analysis plan. After that conclusion, we will formulate some recommendation and apply into the program. And again, after applying in the program, we will identify some knowledge gap or research gap. And again, there will be need of identifying data needs. So for this, we required a proper management in project. So this is the roadmap to study planning and management. These are 5 steps. First is formulating appropriate objectives for the study. Second is to choose the right design to determine key indicators. So what kind of research we want to do, we will choose the right design, and by keeping in the mind our indicators. Then identify the parameters needed for the key indicators. Prepare the analysis outline and estimating the sample size, which is very crucial step. So first is framing the study objective, which is very crucial and critical part of our study. Generally, it is very principle that fewer is better. Sometimes it's a researcher what keeps that he keeps like so many objectives are there, like he is very enthusiastic and keeps so many objectives. So in the end, there will be so much confusion then what to study, what analysis should be done. So it is better to keep 2 or 3 objectives in our project, and they can be mentioned as primary and secondary. So usually sample size is determined based on the primary objectives, and objective should be clearly phrased, like is it aimed at testing hypothesis or measuring the quantity? And it should be stated as to determine or to estimate. If we are testing the hypothesis, then it should be started like to determine, and we are going to measure quantity, then it should be like to estimate. Here example is given, like for hypothesis testing, determine whether a contaminated well cause an outbreak. And second example is to estimate the prevalence of diabetes. So like this, the objective should be framed. Now, second is the choosing the right study design. So study design is chosen based on the nature of our objective. If our objective is descriptive in nature and only one group is there, then we will go for the cohort or surveillance study or cross-sectional study. If the condition is acute, like pneumonia or a diarrhea outbreak, then it is better to do a cohort study or disease surveillance study. And here our indicator will be incidence rate. And if the condition is chronic, like diabetes or hypertension, we are going to observe for a long time. So again, it is better to do cohort or cross-sectional study. Here, what we can get is prevalence rate or incidence rate. Now, if the nature of our objective is comparison between 2 groups, so we can do case control study or cohort study. If we are doing cohort or cross-sectional study, here what we can get is association between 2 groups. So association between exposure and outcome. So that we can get by odds ratio or relative risk. And in a case control study, the association will get by odds ratio. Here, one thing we have to remember is if the outcome is too frequent, so it is better to do cohort study. And if outcome is rare, like a disease is already established and it is rare, so it is better to go for a case control study. Here we cannot do cohort study because the outcome is rare. Now, next step is to identification of the information needed to calculate the indicator. So indicators, what we need, that we have to describe first according to our objectives. So decide the indicators that study will generate later after data collection, like rates, ratios, proportion, or quantitative variables. And for these rates and ratio, we require some numerators and denominators that we have to identify. And also the list information elements that will be used to calculate indicators like outcome variables and covariates like risk factor and confounders. So now what are the principles to be followed while collecting the information of elements? So first is use the variable that will best reflect the information element. So for this, it is important to review the literature. As we discussed in previous classes, the review of literature. Based on this, we can best select our objectives and specify them. Then use validated or standardized method and criteria. Adopt standardized case definition and laboratory criteria or normalities. For example, using a standardized case definition. If we are going to take the cases of pneumonia, so first we have to describe what actually pneumonia is, the clear definition of pneumonia, or some lab confirmation criteria. For example, anemia. If we are going to do study about anemia, then what actually anemia is, that we have to define first in our study, that this level of hemoglobin below this level will be considered as anemia. So that is important. Then decide the most accurate way of collecting information on various elements. So when we are going to collect data, so what is the best way to collect that information, that we have to decide. For example, it could be observation, it could be interview, or it could be laboratory methods. For example, anemia only. If we are going to see for pallor and define the anemia based on the pallor, then the best way is to observe the study participant. And if we are going to ask about sign and symptoms, then interview is best method. And if we are going to check hemoglobin level, then the best method is to go for the lab methods. Here another example is given, the outcome measurement of for iodine deficiency. So if our outcome is chronic iodine deficiency, we want to know that what is the chronic iodine deficiency level. So our information element will be the prevalence of goiter. And here the best data collection method is physical examination of participants. If our outcome is like we want to know the current exposure to the iodine, then the best element to know is urinary iodine excretion. So for this, best data collection method is to laboratory investigation of urine about iodine excretion. And if you want to know the access to the iodized salt, then the information element here is the testing the household salt for the iodine level. So the best way to collect data is going in the field and testing the salt sample. So now these are the example of some covariates in the iodine deficiency. Like there are some risk factors and confounding factors in our study that will be distributed unequally in exposure and associated with exposure and outcome. So potential risk factors like income, the lower or higher level of income, community, caste, education, this will all affect the outcome of iodine deficiency. And confounding factors that we have to keep in mind while designing the research, like age, sex, how they can affect our outcome. So as we discussed about the making the study plan, so what is the advantage of this making advanced plan is it helps us to find focus on our objective of the study without getting distraction. Then start by preparing dummy tables. So it is a better way while you are planning for the any project to do prepare dummy tables. So you will know that what you actually want to what information you actually require and how will you present this. So it is a good practice. Then make sure that only data that can be analyzed is collected. No unnecessary data is collected. So time is not wasted here. So planning is important here. Then saving time, it will help in quick publication and dissemination of your research and policy feedback. Now the sample size, the last point here was sample size. So sample size is very important aspect of any research project. The analysis plan, if we have done advance, it helps to determine the sample size, which is decided on the basis of whether we are going to measure or test something, what kind of research study design we are going to conduct, like it is a cohort study, case control study, or just a cross-sectional study, or the level of study like descriptive or analytical study. So on the basis of all this, we will decide our sample size. So for this, the planning is required. So there are some common reasons why some research study fails. So first is like badly defined research question and badly defined objectives. If you are not clear about your research question or objectives, then it is going to be a failure. Unrealistic time scales, like too short or too long. Then inappropriate and incompetent staff, lack of like if you have recruited staff for data collection and analysis, and then the staff is not trained enough, or there is no motivation for do work, or they require some training and lack of training is there, then this will lead to failure. And inadequate monitoring by the investigator. So again, monitoring and supervision is important part of any project management. So here some attention points for any study or project to make it successful. First is human resource management. For any study, we are going to recruit some human resource. So it is important that our human resources are motivated, trained, and skilled and experienced. Then communication. There should be no communication gap between the members of study. Then time management, which is also crucial, that it should be there is no delay or not too much quick. Then financial management, which is again crucial aspect. Sometimes what happens that there is a good finance for the project, so all finance or the money is released in starting of the research only. Then after some time there is a glitch. So it is better to release the amount in a phased manner. So this is called financial management. Then a quality management, which is again important. The quality of data collection, quality of data management, data analysis, all that. Then teamwork and coordination again, which is required. Then monitoring the progress and targets by investigator, which is again very important. So next we are going to discuss about how to design data collection tool, which is required for planning of our project management. So designing the data collection tool is very important to what actual information we are going to collect or what we need. So usually there are three types of information which we collect by data collection tool: fact, knowledge, and judgment. So in fact, the information like individual characteristics like age, height, clinical history, then facts like environmental history, house, family size, then facts like behavior practices, alcohol use. Then in knowledge, some risk factor and healthy lifestyle, and judgmental information like attitude or opinion of person. So there are different type of data collection tools that we'll discuss. First is abstraction form. So here we abstract the data or pull the data from the ocean of information. Usually we do it by review of records called the secondary data. So it is done by collected from personal records or hospital clinical records, disease surveillance records or registers. Second is structured observation guide, also called the checklist. Usually many times we use in our study. Checklist of items may be in text form or figures. And the last is questionnaire, which is most widely used in research. It could be two types, interviewer administered or self-administered. In interview administered, the data collector asks question to the participants. It could be face-to-face, on telephone, or computer assisted or phone assisted, or sometimes now it is we are using software like AP Collect. And in self-administered, it could be paper-based. Participant himself will administer his data, or it could be computer assisted or Google form questionnaire. So what are the key elements of data collection tool that should we keep and that should keep in mind? The first is clarity of word. So every question we are going to ask, the word should be clear. Then balance of phrases and length of sentence. So all the phrases should be balanced and the length not too short, not too long, like that. Then the response, comprehensiveness of response and constraints in response. So what response we want to get from respondents should be comprehensive. What actually we want to collect data, it should be there. So we should design our data collection tool like that. And if there are any constraint in response that we should address, then utility of instruction, usually called question by question guide, that we'll discuss later. Utility of instruction, the every question should give an instruction, then how this question should be asked to participants. Then order of question should be properly ordered in a manner and context of question. So what we are going to exactly ask. So there are four components of any data collection tool. If you are going to make a data collection tool or a case record form that we call, so it has four parts. First is introduction in starting and conclusion in the last. So in introduction, we usually presentation of our study objectives, so what we are going to do. So participant will know about the study. Then important of keeping element of informed consent, which is very important. Then concluding statement in the conclusion part, in the last part of the data collection tool, we will keep some concluding statement for thank you for the participation in the study, like that. Then second is identifiers. So what are the identifiers? The exact identifiers of the participant, like name and address, is better to keep collect them and keep in separate page. But here also we have to keep in mind about the concept of confidentiality. So we will code the identifiers and giving the coding to every participant according to their name or address, like that. So these are the identifier part. Third is instruction for data collector. So person who is going to collect data, field workers, for them there will be instruction. It should be given in data collection form. Some prompts, skip patterns, like if the answer of the question 12 is yes, then go for question 13 and 14, and if the answer of question 12 is no, then jump to the 15 number question. This is called skip pattern. Then use different type of prompts for according to importance of the question or topic. Then the body of the data collection tool or instrument or our question. So these are the types of open items, closed items, and semi-open items that we'll discuss here. First is open questions. So what are the open questions? Here, answer are not suggested. Respondent must generate their own answer. For example, what disease can acquire from tobacco, or what place did you eat in the week preceding the disease? So here we are not giving any option to them. The respondent will generate their own answer. So here advantage is that we give freedom of response to the participants, and it will stimulate the memory, and we will get exact information without any confusion, and it can be useful later for generating close response. Sometimes it is inconvenient because it is difficult for the coding and analyzing. It is like a qualitative question, qualitative study. We use this kind of open question. So it is difficult to code and analyze the question. Then the answer may be incomplete or unfocused. So these are the disadvantage of open questions. Next is open question with close-ended answers. So here options are given, but answer is not suggested to the respondent. For example, what are the practices that may increase your risk to get a heart attack? Here we not give any suggestion, like options are given and in the bracket it is given yes or no. So respondent himself will choose any one option. However, among the answer field mentioned, the interviewer will tick those spontaneously specified, expressed as an open question, and here analysis will be done as close-ended question. Another one is close-ended questions. Here only two types: dichotomous option and multiple choice option. The first is dichotomous option. So here answer suggested in dichotomous, like yes or no, male, female, like that. Here example is given: did you eat restaurant X between 1 and 28 February, like that. So advantage is it forces a clear position and may be useful for the key important well-framed issues, and inconvenient sometimes because it oversimplifies the issues. Next close question types is a multiple choice question. Here we allows the multiple option of answer and suggested multiple answers. So one or multiple answer are acceptable here. Advantage is larger choice of answer options, and sometimes it is difficult to choose only one option. For example, where do you go for seeking treatment for the fever? So these are the multiple answers. So sometimes it's difficult to choose only one answer. Next one is semi-open questions. Here, answers are suggested, and one option is kept for like a possibility to create another answer. Like last option here is others specified. Did your child have complication following measles? And options are given, and last option is like others specify. So advantage is it leaves the open door to plan to unplanned answers, and sometimes it is difficult to analyze. Now, how to formulate question that we are going to ask to respondent. So write short and precise question, full and complete phrases. For example, if we are going to ask the age of the patient, it is better to ask in a way like, what is your age in years? So it is called full and complete phrases answer. So there will be no any confusion, and avoid ambiguities. Use simple words of everyday language to avoid any misunderstanding. Then avoid negatives and double negatives. For example, if we ask a question like, do you sometimes care for the patients without washing your hands? So this is not appropriate answer. It is confusing. So better way to ask is, do you systematically wash hands before caring for each patient? So this is the proper way to ask question without negatives. Another aspect is ask only one question at one time at a time. For example, if you are asking question like, did you refuse treatment because you feared side effects? So here we are asking two questions at a time. So this is not an appropriate way. Better way to first ask about, did you refuse treatment? And the answer is no, then skip. And if the answer is yes, then ask why. This because you feared side effects. So this is the proper way. Next is be specific about your question. For example, if you are asking question about HIV, so are you aware of the modes of transmission of HIV? So this is like open-ended question. Here there is no specificity. So better way to give them option, and among these options, can you tell me that what could expose you to the HIV? So this is the good way. Then use neutral tone to avoid influence. Sometimes what becomes that of a data collector or the investigator becomes judgmental. So judgments are avoid being judgmental here. For example, asking you a question to participant like, have you been promiscuous in the last 6 months? So this is not a good way. Better to ask like, how many partners have you had in the last 6 months? If we are asking about HIV transmission. Now, next important thing is to sorting the order of question. The question should be sorted in order to maintain the flow of question. So it should start from simple to complicated. First, we'll ask simple question, then go for complicated one. Go from general to specific question. Go from casual to intimate. First, we'll ask about the casual, socio-demographic information like age, residence, like that, and then go for the sensitive topic. So it is a better way. Then group together question related to the same topic. So there is no after that collection of the data. So it is better to group the same type of question in one section. Identification question at the beginning or at the end. So some identification questions about a participant is there. So it is better to keep them in the beginning or keep it at the last. Then arrange the question in chronological order if the questions are related to any sequence of event. For example, food poisoning, if we are going to ask, so we have to keep this question in order, that where you ate last night, what symptom first started, where you get treatment, like that. Then triangulation through multiple question on the same topic if subject is important. If our question is important, getting answer is important, then we will ask that question multiple times in this different section and compare the answer every time to check that answers are consistent or not. So it is called triangulation. So after the sorting the question, it is about laying out the data collection tool. How our data collection tool should uh, uh, should be visible, like how it should be occur, like a layout data collection tool. So first is split the tool into clear section. It is a good practice to keep section in your data collection tool. Then space out the questions. Use large and readable fonts. Align the answers and codes on the right hand side and question on left hand side. Then number all the questions sequentially. Then one thing is do not split the question across the pages. If half question is on one page and second half is on the next page, it is not a good practice. So keep the question in one page only. Do not split the question. Then use a vertical format for closed-ended question. If you are going to give option, it is keep in vertical format, not horizontal. Then standardize coding across the question for data entry. And after laying out the data collection tool, we will finalize our tool. It is done by checking the instrument against the objective. So if there are some unnecessary questions which are not related to our objective, we should remove them and add some missing question if it is there, and review the instrument with our colleagues or expert in that area, or statistician for the data entry and coding, and field workers who are going to ask the question. So if they are having any difficulty in asking questions, so review is important for finalizing the tool. Then language of the instrument. So it is important to write the data collection tool question in vernacular language, what we are going to ask the participant, what their understanding language is there. So translation is required. So initial formulation will be in English only. Then we will translate in Hindi or Gujarati that we are going to ask to the study participant. Then again back, it is translated to the English. And here we check that the interpretation of question is not changed. So it is very important part. And after finalizing the data collection tool, we go for the pilot testing. So why pilot testing is required? So any kind of error or difficulty in data collection is there, we can identify it before the actual starting of data collection. So in pilot testing, we check that the instrument is clear and questions are specific, questions are understandable and acceptable by the participant. Then we'll check the flow of question in the study tool. Then check the pertinence of the coding, that code that we have given for the entry is appropriate or not. Then estimate the time needed to ask all the questions. What time is required for one participant for asking all the questions, that we will estimate, and according to that we will plan our study. Then pilot test with a few volunteers. A person similar to the study population should be chosen for the pilot testing. And when we are actually going to start our data collection, this person should not be there in our study. So after designing data collection tool, we will discuss about what are the principles of data collection. So data collection, we require data quality, and here there are two principles, reliability and accuracy. That discussed earlier, that reliability is like reproducibility or repeatability or precision. It is the ability of a measurement to give the same result every time when repeated. Refers to the stability or consistency of information, and accuracy means giving the correct result every time or on average. So here this image show example show the what is reliability and accuracy. So the first one shows that it is reliable and accurate. It is giving the every time same result and correct result. Then the second one is like it is reliable, giving same result every time, but not accurate. What we are going to measure it not measuring. And third is accurate but not reliable. This happen when the another investigator used the data collection tool. The information will be different. So it is accurate but not reliable. The result will be different. Then not reliable, not accurate. So there are 6 principles or 6 steps in the data collection. First is draft question by question guide. Second is train staff member who will collect the data. Initiate data collection and ensure the quality. Fourth is review collected data for quality and completeness. Then debrief to troubleshoot difficulty and validate. The first is draft question by question guide. So what is question by question guide? It is a short document to be understood as a guide for the field workers. Sometimes what happens for the same question, there will be different interpretation by different workers. So it is important to guide them regarding the interpretation of questions. So we will give one small instruction at the end of the question that how this question should be asked. So consider each question number by number, provide guidance as to how the data should be collected. And it is used as a roadmap for the good data collection. which is drafted initially and revised if there is any issue. For example, if we are going to collect data about housing of a participant, so the in bracket small instruction will be given like observe the house and note if it is made up of mud or concrete or bricks. So this is called guide that how to collect or how to ask this question. It is called Q by Q guide. Another example is household income. We will not directly ask the participant. What we will do here, the instruction is given like identify all the person with financial income in household, then estimate their source of each source of income and sum up to generate the household income. So this is called Q by Q guide. Second is train staff who will collect the data. So selecting good and experienced staff is very important for any research project. So first is select the good staff, which is experienced and motivated. Then present the study and its objectives in lecture hall, lecture room, and explain about the what we are going to do in our study. And then distribute our data collection tool question by question guide and let them read it thoroughly and give them time to understand the research. And let them ask the question and answer all the question of staff and list the task to be conducted by each and individual. And last, simulate the interviews within your team before actual starting of data collection. Third is initiate data collection and ensure quality. So before starting actual data collection, we will do piloting. So do piloting on the site interviews under supervision and note the issues that may come up during the piloting and resolve them before starting the study and continue until the procedure is clear to everyone. Then plan data collection process with supervisor and investigator. Ensure that study forms are verified by supervisor every day for any errors. So it is very important that the investigator ensures this and being available to answer the question, do on-site visit and do not press for quick completion. Otherwise, the quality of data will be compromised. Fourth step is to review the collected data for quality and completeness. So each team as a supervisor checks the data collection instrument before the respondent leaves. The supervisor checks the instrument before leaving the location and all takes the responsibility for the instrument by giving name and signature after the data is collected from the respondent. Then principal investigator checks instrument as they come to them in last. Now what to check in data collection quality and completeness. The first is completeness. Did the field worker fill the all items in the data collection tool? Then readability. Sometimes what happens, the readability, the answer is not marked as they are not readable. So is the writing is readable? That we have to check. Then consistency. Do the answer make any sense? That investigator will check the consistency. Is there any internal consistency? Next is debrief to troubleshoot difficulties. It is done by regular meetings, evening or morning, and facilitate discussion about is there any issue identified during data collection or any clarification is needed or not, and make these notes of the decision that this type of correction was done. And last and not least, very important, the validation. To select the number of study participant at random. For example, 5% of study participant we choose, then conduct the second interview again, and we will compare the result with previous result. So it will we will cross check here the result to check the quality of our data collection. Is it consistent or not? So here we will debrief discrepancies with if there is any discrepancy, we will debrief it with individual investigator if they have errors made by them or the whole team is making any mistakes, then we will debrief with them. So what take home message here about the data collection tool is understand the concept of data quality and then form the data collection tool. Good training of off-site and on-site is essential of our staff members. Then supportive supervision and teamwork are key to good quality data collection. Thank you. Everybody. How are you? Okay.
Thank, thank you, Dr. Vijay. Now I would like to request Dr. Harshit. Dr. Harshit is SR in Department of PSM. Dr. Harshit will discuss on topic of data management.
Good evening, everyone. Now we will see data management and overview of data analysis. In data management, we will include define variables, create study database and data dictionary, enter data and correct errors, create database for analysis, backup and archive the data set. In define variable, clear-cut definition of variable should be decided prior the data collection. This is a structure of a database where you can say that there is a row and column. In first column, we can see that the identifier means that every person or every study participant should have a different or unique identifier number. And in variable 1, 2, 3, 4, and etc. Like example, variable 1 means we can say that age, variable 2 means gender, variable 3 means any socioeconomic group or any other for your study. In row, we can see that the record 1 means that each row is for each study participant, means that that record 1 is I am the study participant, then all my detail of regarding the study will be on that row only. So identifier means my any unique identifier number. In variable 1, let example that there is age, then my age. In variable 2, my gender, like that only. In unique identifier number, we can say on right side that 1, 2, 3, 4, 5, 6, 7 in पहले दो मतलब फर्स्ट एंड सेकंड डिजिट फॉर एग्जांपल डिनोट द विलेज एनी नंबर विच डिनोट द विलेज 3 and 4 मतलब थर्ड एंड फोर्थ डिजिट इज फॉर street of that village, fifth digit is a house from that street, and 6 and 7 digit are for person. So unique identifier may contain all information about that particular ID. Each digit or set of digit refer to a specific information and which is the unique for every study participant. Structure of the variable in the data set. How will you take the detail regarding the particular variable? Like you have to decide earlier to data collection that like you will collect a whole number like 3, 4, 5, no any decimal. In numeric, your detail will be on a decimal number like 3.5 or 3.6 or not. Alphanumeric. I'm audible now?
Yes, yes.
Okay. Now in alphanumeric, uh, earlier also you have to specify the length of your variable or any, because in some the software there is a limit of character, and turn on letter of capital. Matlab, uh, please take only capital letter and specify dates like you will write in DDMMY format or MMDDY format. Creating variable name. Uh, Please give clear, simple, and understandable name for all variable. Like you have to, your question is like, do you do exercise daily? Then you can write a name exer daily or anything, but clear, simple, and you can understand that what is that your question. Short and no space. Most software require less than 10 character. So keep it short and consistent. Like your different question exercise daily in the past, then you can keep it exer past, or exercise daily in the current, then exer current daily. So according to your question, you can write your variable name. ऐसा नहीं है कि सब यही रखिए, आप अपने हिसाब से कोई भी रख सकते हो, बट जो आपको समझ में आए ऐसे. नो डुप्लीकेट. You have to give name of each variable by yourself only. आप खुद ही अपने दर ईच वेरिएबल का नाम रखिए, क्योंकि अगर आप सॉफ्टवेयर पे रख देंगे तो सॉफ्टवेयर वो नाम रख के तो देगा, पर उसमें चांसेस है कि वो डुप्लीकेट हो सकते हैं, क्योंकि वो अपने हिसाब से ही ट्रिम कर देगा वो क्वेश्चन को. डिजाइन डेटा एंट्री फ्रेंडली डेटा कलेक्शन इंस्ट्रूमेंट. Prior only you need to have broad idea of your data collection tool and which section within the it, like your data set contain identifier and the socio-demographic detail, outcome of your health, matlab study which you are studying the health problem or disease, your variable like exposure variable or anything other third factor or confounding factor. Coding. It is advisable to prefer numerical coding. जितने भी कम स्ट्रोक रखोगे आप कीबोर्ड पे, उतना कम चांस है एरर होने का, क्योंकि आप आंसर आ रहा है जेंडर में मेल या फीमेल आ रहा है, तो कोई सारे कैपिटल में लिखेंगे, कभी कभी सारे स्मॉल में लिखेंगे, कभी एम कैपिटल करेंगे दूसरा स्मॉल करेंगे, तो चांसेस है एरर ज्यादा होने का. तो उसके वजह हम वी कैन कोड एवरी आवर पॉसिबल आंसर लाइक मेल 1 फीमेल 2 एंड डू लॉजिकल कोडिंग लाइक यस और नो में आंसर आ रहा है तो नो में हम 0 रख सकते हैं, यस में 1 रख सकते हैं. डिसाइड कोड फॉर मिसिंग वैल्यू लाइक 999 और 999. आप कुछ भी उसमें से रख सकते हो, और हर बार अगर मिसिंग वैल्यू है तो आप उसमें वो लिख सकते हैं. नॉट एप्लीकेबल में 8 या 98 जो भी आप कोड डिसाइड करें वो रख सकते हैं उसमें. कंस्ट्रक्टिंग डेटा डिक्शनरी. It is advisable to prepare a data dictionary for each and every variable you are studying, which contain a variable name, description of questionnaire item, like हम अभी टेबल में देख सकते हैं कि एक्सरसाइज डेली वो 1 वेरिएबल है हमारा, वो उसका आंसर किस टाइप में, वो इंटीजर में आ रहा है, वो नंबर ही लेना है. उसमें क्या आएगा, यस या नो आंसर आएगा, यस का क्या हम कोड कर रहे हैं, नो का क्या कोड कर रहे हैं, वो सब उसमें रखिए. तो बाद में भी अगर आपको डेटा सेट में जाते आपको कुछ कंफ्यूजन है तो आप उसमें जाके देख सकते हैं. एंड अगर आप किसी और से भी शेयर कर सकते हैं तो उसमें उसको भी पता चलेगा कि वो आपका कोडिंग या आपका वो पूरा वेरिएबल क्या है कैसे है. चेक स्पेसिफिकेशन बिफोर द डेटा एंट्री. अगर आप डेटा एंट्री कर रहे हैं तो आप मिनिमम मैक्सिमम वैल्यू मतलब चेक्स रख सकते हैं, डेटा वैलिडेशन कर सकते हैं टू मिनिमाइज द एरर. अगर आपका स्टडी पार्टिसिपेंट लेस देन 5 ईयर, अंडर 5 ईयर एज ग्रुप का है, तो आप ऐसा कर सकते हैं कि उसमें आप डेटा वैलिडेशन या चेक रख सकते हैं कि एज ग्रुप में 5 से नीचे कुछ वो सेल लेगा ही नहीं एंट्री। तो अगर आप मिस्टेकन भी कुछ डाल रहे तो आप पता चल जाएगा कि वो मिस्टेक हो रहा है यहाँ पे। यू कैन ऐड स्किप पैटर्न्स, लाइक हमारा क्वेश्चन है कि डू यू डू एक्सरसाइज डेली, यस या नो। यस है तो उसमें आगे आएगा कि कौन सी एक्सरसाइज कर रहे हैं, कितने टाइम कर रहे हैं। अगर नो है तो ये सारे क्वेश्चन स्किप हो जाएंगे। तो ऐसा भी आप रख सकते हैं। कैलकुलेशन, हमारा वेरिएबल ऐसा होगा कि हाइट एंड वेट, तो वी कैन एंट्री फॉर हाइट एंड वेट, बट वी हैव टू कैलकुलेट द बीएमआई, देन फ्रॉम दैट हाइट एंड वेट वी कैन कैलकुलेट द बीएमआई। During data entry, use the opportunity for a partial data cleaning. You can clean your data for some mistakes. You can write comments and seek clarification for that. And during the data entry, mark each paper as a data entry is completed. अगर सारे जिसकी डेटा एंट्री हो गई है तो उस पर आप मार्क कर सकते हैं कि ये इसकी डेटा एंट्री हो गई है। Aggregating individual data. On left hand side, that we have a individual data, that ID, place, age, sex, onset. On our right hand side, the aggregated file. So you can see that on two instance, ID 1 and 5, that come from a one place A. So you can aggregate according to your analysis plan, that from place A how much that count, from place B. So this is the aggregated file of your individual data. Mother and daughter database. Information is available at various level, like you have information at all village level, from all household level or individual level, and also illness episode from that individual person or individual study participant. Store information at each level in separate database. अब सारे इंफॉर्मेशन ईच लेवल, मतलब हर लेवल की सारी इंफॉर्मेशन आप अलग अलग डेटाबेस में रख सकते हैं, उसको रिपीट करने की जरूरत नहीं है। और जब जरूरत पड़े तो हम उसको लिंक कर सकते हैं फ्रॉम दैट यूनिक आइडेंटिफायर नंबर। लाइक हम यहाँ देखें कि हाउस होल्ड लेवल डेटा है और इंडिविजुअल लेवल डेटा है। तो इन फर्स्ट कॉलम देज हाउस आईडी, एंड सेकंड कॉलम देज लोकेशन, थर्ड कम्युनिटी एंड हाउस होल्ड इनकम। अगर हम राइट हैंड साइड देखें इंडिविजुअल डेटा में, तो हाउस आईडी 1, दो हाउस, पहले हाउस में से दो पर्सन है, 101 एंड 102, उसमें डिसीज हुआ है कि नहीं उसका कोड किया हुआ है हमने, तो इंडिविजुअल लेवल का डेटा है। और लेफ्ट हैंड साइड में हाउस होल्ड लेवल का डेटा है। तो हम उस ईच डेटाबेस को हम यूनिक आइडेंटिफायर जो हाउस आईडी है उससे हम वो मर्ज कर सकते हैं, लिंक कर सकते हैं। समिंग अप ऑन डेटा मैनेजमेंट, कोड डेटाबेस न्यूमेरिकली, हो सके तो जितना हो सके सारे जो आपके आंसर आ रहे हैं उसको आप न्यूमेरिकली कोड कर सकते हैं। एंटर डेटा यूजिंग क्वालिटी एश्योरेंस प्रोटोकॉल, डेटा एंट्री के टाइम में आप क्वालिटी का आप ध्यान रखिए। स्टोर इंफॉर्मेशन एट द लेवल वेयर इट नीड टू बी स्टोर्ड, और जब जरूरत पड़े हम उसको मर्ज कर सकते हैं या लिंक कर सकते हैं। ओवरव्यू ऑफ डेटा एनालिसिस, इन we will see that identifying study type, identify main variable, become familiar with the data, characterize study population, examine outcome or exposure association, create additional two-way table, and conduct advanced analysis. Identify study type. During preparation of proposal only, आपका रिसर्च क्वेश्चन कौन से टाइप का है, उसके हिसाब से आपका ऑब्जेक्टिव कौन से टाइप का है, और उस रिसर्च क्वेश्चन और ऑब्जेक्टिव का आंसर आप कौन सी स्टडी से दे पाएंगे, आप उस हिसाब से तभी वो स्टडी चूज कर सकते हैं। बाद में भी आप रिव्यू और प्रोटोकॉल फॉर स्टडी ऑब्जेक्टिव एंड स्टडी टाइप, रिव्यू क्वेश्चनर, रिव्यू एनालिसिस प्लान एंड डेटा कलेक्शन प्रोसीजर, और आप उस जो भी स्टडी आपकी है टाइप उस पर आप फेमिलियर हो सकते हैं। एस्टेब्लिश मेन एनालिसिस फ्रेमवर्क, आपकी स्टडी डिस्क्रिप्टिव टाइप की है या एनालिटिकल टाइप की है। डिस्क्रिप्टिव टाइप की है तो आप उसमें फ्रीक्वेंसी या क्वांटिटी मेजर कर सकते हैं। अगर कंपैरिजन ग्रुप है, एनालिटिकल स्टडी है, तो टेस्टिंग ऑफ हाइपोथेसिस। नेचर ऑफ योर रिसर्च क्वेश्चन डिस्क्रिप्टिव टाइप का है, एक ग्रुप है, आपको डिस्क्राइब करना है, तो उसमें देख सकते हैं कि आउटकम एक्यूट आ रहा है, क्रोनिक आ रहा है। अगर एक्यूट आ रहा है तो इंसिडेंस, या क्रोनिक आ रहा है तो प्रिवेलेंस मेजर कर सकते हैं। एनालिटिकल अगर दो ग्रुप कंपेयर करना है तो स्टडी आउटकम देख, एक्यूट है तो बेस्ड ऑन स्टडी डिजाइन आप रिलेटिव रिस्क या रिस्क रेशियो कैलकुलेट कर सकते हैं। अगर केस कंट्रोल है तो ऑड्स रेशियो कैलकुलेट कर सकते हैं। क्योंकि स्टडी आउटकम इज क्रोनिक, डिपेंडिंग ऑन योर स्टडी टाइप, प्रिवेलेंस या ऑड्स रेशियो कैलकुलेट कर सकते हैं। आइडेंटिफाई मेन वेरिएबल्स, योर आउटकम वेरिएबल, एक्सपोजर वेरिएबल, यानी थर्ड पार्टी या कंफाउंडिंग वेरिएबल, एंड वेरिएबल फॉर योर सब ग्रुप एनालिसिस। Become familiar with your data. After data entry and before data analysis of you can do your frequency distribution for your data for each and every variable. आप जितने भी वेरिएबल है उसके लिए उसकी फ्रीक्वेंसी डिस्ट्रीब्यूशन का आप एनालिसिस कर सकते हैं पहले, जो इस जिससे आपको आइडिया आ सके कि आपका डेटा इस तरीके का है। रिव्यू नंबर ऑफ ऑब्जर्वेशन बाय स्टेटस इन द डेटाबेस, लुक फॉर डुप्लीकेट्स और लुक फॉर मिसिंग ऑब्जर्वेशन, तो तभी आप देख सकते हैं उसमें। चेक रेंज एंड लीगल वैल्यूज, कोई मिस्टेक है या कितनी रेंज है मिनिमम से मैक्सिमम तक और चेक कंसिस्टेंसी एंड पैटर्न। कैरेक्टराइज स्टडी पॉपुलेशन, बेसलाइन कैरेक्टरिस्टिक, द डिस्ट्रीब्यूशन ऑफ स्टडी पार्टिसिपेंट बाय सोशियो इकोनॉमिक ग्रुप और लाइक एज, जेंडर, इनकम, frequency of clinical feature, health problem, or in analytical study for compared group, comparison group for examine outcome और exposure association based on prior hypothesis। अगर comparative group है तो आप उसमें association लगा सकते हैं। और also you can prepare as additional two-way table। In advanced analysis you can do dose response analysis, stratification or multivariate analysis। Prepare data analysis advanced, use empty table or we can call dummy table, should be prepared earlier to analysis। अब डमी टेबल या एम्प्टी टेबल एनालिसिस के पहले ही प्रिपेयर कर सकते हैं। सो ड्यूरिंग एनालिसिस यू हैव टू फिल ओनली दैट डमी टेबल। आप एनालिसिस करते जाइए और वो डमी टेबल को आप भरते जाइए। एनालिसिस बाय स्टेज इन सीक्वेंस, पहले डिस्क्रिप्टिव एनालिसिस कीजिए, आप ओवरव्यू लीजिए आपका डेटा कैसा है, उसके बाद में एनालिटिकल एनालिसिस पे जाइए। अवॉइड डेटा ड्रिवन एनालिसिस विच यू नोट नीड नो, मतलब पहले जो प्लान नहीं किया था, ऐसा वो हमारा ऑब्जेक्टिव नहीं था और हमें अब डेटा मिला है तो हम उस पे जा रहे हैं, जैसे पोस्ट हॉक एनालिसिस कर रहे हैं, तो अवॉइड कीजिए उसको। इनिशियल स्टेजेस ऑफ द एनालिसिस, तो रिकॉर्डिंग स्टेज आता है, क्रिएट आउटकम डेटा, रिकॉर्ड की वेरिएबल लाइक एज ग्रुप, इनकम, एक्सरसाइज। एक्सरसाइज में आता है मॉडरेट है या है, इनकम में कौन अपर क्लास है बिलो क्लास है, अगर आपको रिकॉर्ड करना है तो उसमें रिकॉर्ड करें पहले। डिस्क्रिप्टिव स्टेज में कैलकुलेट फ्रीक्वेंसी ऑफ आउटकम अमंग वेरियस ग्रुप, वेरियस ग्रुप में आप फ्रीक्वेंसी ऑफ आउटकम देख सकते हैं कितनी फ्रीक्वेंसी है किसमें। एनालिटिकल स्टेज, यूनिवेरिएट एनालिसिस, फ्रीक्वेंसी ऑफ आउटकम बाय एज, जेंडर, इनकम, बाय इनकम कैटेगरीज लाइक डोज रिस्पॉन्स इफेक्ट। स्ट्रेटिफाइड एनालिसिस में अगर हमारा एक्सपोजर है ब्रिस्क वॉकिंग और देख रहा है आउटकम में कि रिडक्शन इन ब्लड ग्लूकोज लेवल कितना हो रहा है, तो हम उसमें फ्रीक्वेंसी देख सकते हैं कि वो स्ट्रेटिफाइड एज, जेंडर और इनकम का स्ट्रेटिफिकेशन करके हम देख सकते हैं कि कितनी फ्रीक्वेंसी में क्या है, और ऐसे इस दूसरे वेरिएबल्स से स्ट्रेटिफाइड करके उसका एनालिसिस कर सकते हैं। मल्टीवेरिएट एनालिसिस, एनालिसिस में लॉजिस्टिक रिग्रेशन मॉडल अप्लाई कर सकते हैं टू प्रिडिक्ट द रिडक्शन इन ब्लड ग्लूकोज लेवल। use software for data management and data analysis. Avoid spreadsheet. हमको ऐसा होता है कि डेटा कम है हमारा, मीन मीडियन स्टैंडर्ड डेविएशन है, तो हम वो स्प्रेडशीट में ही कर देते हैं। बाद में कुछ एडवांस एनालिसिस होगा तो हम सॉफ्टवेयर में करेंगे, तो ऐसा मत करिए, उसको अवॉइड करिए। यूज सॉफ्टवेयर फॉर डेटा मैनेजमेंट एंड डेटा एनालिसिस टू लाइक एपी इन्फो। थैंक यू।
Thank you so much, Dr. Harshit, for sharing your wisdom. Now, next lecture will be on ethical framework for health research. It will be taken by Dr. Arpita ma'am. She is Associate Professor in Pathology Department of Government Medical College, Surat.
થઈ ગઈ અનમ્યુટ પીપીટી કરી દો સ્લાઇડ શો વિડિયો भी ऑन કરી દો કઈ નહીં ડિસેબલ રહે Hello, good afternoon. Am I audible?
Yes, ma'am. Yes.
Okay, okay. Share कर શેર નહીં હતા પછી શું થયું I'm not able to share my screen. Can you just, I'll just take 2 minutes to see.
હેલો અર્પિતા મેમ,
Yes.
દેખાય છે તમારી સ્ક્રીન?
દેખાય છે મને નહીં દેખાયતી એટલે હા yes okay okay દેખાય છે ને
હા હા દેખાય.
okay okay yeah thank you. So in this session we will discuss about the ethical issues for health and biomedical research. Now, this is very important because we as researchers should know how to protect the welfare and safety of the research participants who are going to be part of our study. So, ethical foundation is very crucial for research and it includes all types of health research. Any research which involves human participants should follow some international standard of ethics. Now, there are many international standards of ethics which have been laid down. In addition to that, Indian national standard guidelines have also been laid down and we are not behind the international standards. We are at par with them. And these ethical Indian national standards have been developed by the Indian Council of Medical Research, that is the ICMR. And we are supposed to be within this international and these Indian national guidelines. Now, ethical review is mandatory for all research. Okay, there is a feeling, somehow that ethical review khali udhar hi jaruri hai. It is only important when there is significant risk involved to the participant or when there is an invasive procedure involved. But no, it is not like that. Ethical review is also mandatory in situations when no risk may be involved, when you are using only the available data, Minimal risk is involved. Oh, you're asking only questions, not collecting any specimens or samples. Even in all these cases, ethical review is important and mandatory. That is what we have to keep in our mind. Now, how did these documents come in? Let's see the evolution. You know, it began after the World War II. It was believed that, it was seen that in World War II, many atrocities were carried out on the participants, the prisoners who were captured in the World War in the name of research. And so after that, this in 1947, first the Nuremberg Code came in, which initiated discussion on the rationale and justification of research risk-benefit analysis, competence of investigators, and voluntary consent in research. Followed by 1964, the Helsinki Declaration came in, which talked about informed decisions, research participant welfare and vulnerability. Then in 1978-79, the Belmont Report came in, which first time described the basic principles of ethics, that is autonomy, justice, beneficence. It emphasized the informed consent, and for the first time, it talked about review by the ethics committee. Then in 92-93, CIOMS guidelines came in, which talked about the adverse drug reactions, need for pharmacovigilance, and safety of research participants. Then in 1996, the ICH gave guidelines about the good clinical practice. These were all international documents. Then Indian documents came in. In 2000, our ICMR made these guidelines, which were then revised in 2006, and now then later on in 2017, which are the ones which we are following. And these are available on the ICMR website. It states that all institutions in the country which carry out any form of biomedical research which involves human beings should follow these guidelines. It is mandatory to follow these ICMR guidelines. Now, in addition to these ICMR guidelines, there are several other national guidelines also available, and which are, relevant to the area in which people are working. So if you're working in the area of genetics, in addition to the ICMR guidelines, you need to follow the genome policy and genetic research guidelines. If you're working in the reproductive technology area, you have to follow the assisted ART guidelines, stem cell research and biobanking guidelines, amendment of drugs and cosmetic guidelines. So these guidelines are to be followed in addition to the ICMR guidelines. Now, we talked about the principles of ethics. Now, there are these 4 are the principles of ethics which all researchers must follow. And the 4 principles are respect for autonomy, justice, beneficence, and non-maleficence. What do we mean by all this? Now, autonomy. Autonomy is Latin for self-rule. And basically what it means is we have to respect, we are under an obligation to respect decision made by the people regarding their own lives. So in terms of research, if we say, it means that we must respect the participants' wish or their decision to take part or not to take part in the study. We must not interfere with the decisions of competent adults to take their own decisions. We must respect their decisions. Unko part lena hai study mein, to haan kahe. And if they say no, they don't want to take part, we have to respect those decisions. But yes, at the same time, if they are not aware of the details of the research, it is our duty to make them aware, to empower them. And once we empower them, then it is their decision to take part or not to take part. But then their decision will be an informed decision because we inform to them about the study. Next is the principle of justice. What do we mean by justice? Justice means equal distribution, equal treatment to all people, equal, fair, impartial treatment to all people, irrespective of their caste, their gender, their ethnicity, everything. So irrespective of anything, all participants, they must get an opportunity to participate in research, unless contraindicated, such as in example in pregnancy. So in that case, we don't have to impose on them any research, but otherwise we must treat them all equally, not that females are not to be taken in a particular study or like that. So it has to be equal distribution. Then comes beneficence. Beneficence means do good for others. So we must be fair and take positive steps to prevent any harm, and pursue beneficence. Do whatever we do in our study, it must be for the benefit of the patients and not for any harm. Then comes maleficence. Maleficence literal meaning is do no harm. So we must not harm others, and whatever harm is there, suppose we are doing a study, there are some minimal side effects also. We must try to minimize them or to take care of those side effects using our healthcare workup. And so that is, we should not do any harm to the research participants. So these are the 4 principles of ethics. And to keep this, follow these 4 principles, we take an informed consent. Now, what is an informed consent? So informed consent is the process. It is not just a tick mark, it is a process. It's a systematic process in which we systematically inform the participants, potential. See, until they don't give a consent, they are potential participants about the proposed research. So we inform them in detail, step by step, about the proposed research, and this empowers them to take an informed decision to participate in the research study. And that is why we say it is not a consent, it is an informed consent. So what do we do in that systematic manner? We explain to them, we make them understand the study procedures, the risks, the benefits that are involved in the study. They are allowed to ask any number of questions, their concerns. We all address and answer their questions. And then we let them take a learned and an informed decision whether to participate or not to participate. Now, this process is not a one-time process. It can be repeated several times, even during the study. ऐसा नहीं है कि बस starting में कर दिया तो कर दिया. But if the participants want to be explained even during the study, it is our duty to explain it multiple times also. Now, in certain studies, like the tribal studies, a group consent is also can be taken. But remember, group consent cannot replace the individual consent. Now, informed consent cannot be just orally. It has to be documented. And so an informed consent document has to be made. And this document consists of, on the top in the header, there is the name of the project and the agency which is doing it. Then comes the main body part. In this body part, there has to be a brief description of the research that is going to be carried on, the risks that will be, the potential risks that will be involved in the study, the benefits that will be there. Now, sometimes it is there that there is no individual benefit, but it is a benefit to the community. Now, that has to be explained to the participant. Then alternatives must be explained. Suppose the participant does not want to take part. So he has to be explained that irrespective of his participation, his treatment will be carried out in the standard manner. Then assurance of confidentiality has to be there, very, very important, because there are some sensitive information that the participant may be sharing with the researcher. So assuring confidentiality is very important. Then compensation has to be mentioned, compensation for any harm that the researcher bears during the study. Then contact number of the place and number of the researcher. This is very important. In case any queries, in case any side effects, the person can contact the researcher. Then very important is the voluntary participation and withdrawal. The informed consent should mention that the participant it is his voluntary wish to participate, and the participant can withdraw from the study any time during the study. So ये बहुत important है कि पूरी study में वो कभी भी withdraw कर सकता है. ऐसा नहीं कि starting में कह दिया तो बाद में नहीं कर सकता. Any time during the study. And then below there has to be the signature of the participant. So this is an informed decision that he's taking, and signature of the witness who is not part of the study team. This will be the informed consent document. Now, who are the stakeholders in IC process? So stakeholders in informed consent process are the researchers and the institution, because they have to inform, explain to the participant and answer their queries, and only then the informed consent has to be taken from the participant. It is the participant again who are the stakeholders also, because they must understand, and only after understanding they have to agree to the research proposal participation. Then the sponsors, the monitors, the regulators, they are all a part of the stakeholders, because they assess the fairness of the consenting procedure. Barabar hua hai ya nahi ye procedure. And these sponsors, monitors, regulators, they have the authority to verify they can verify that consent document. Important part questions related to informed consent is, whom does it benefit? So it benefits both the research participant and the investigator, because with this it is clear that both have understood the thing and everything is done in a good manner. Is the research procedure adequately explained in the IC form? That to answer this question, it is important that the informed consent be in a very simple language, and local language should be there. So the consent should be in languages, like in our institute, we have it in English, in Hindi, in Gujarati, all local languages. Then it should be translated back to English and back translation, just to see that the translation has been done in a very clear and simple manner. Can there be different types of informed consent? Oral consent, some people talk about, but no, we talk about, mainly consider the traditional written informed consent form, which I've already discussed before. Audiovisual consent is nowadays, it is by the in the ICMR guidelines, it is there for the new drug trial, vaccine, and these research studies. In addition to informed consent, there is a thing called as an assent. So in the age group, children or adolescent in the age group 12 to 18, in addition to the informed consent of the parents, there has to be an assent taken by the children or adolescent in the age group of 12 to 18. Now we come to the importance of scientific review. When we talk about ethical considerations, who looks at all this? We see, so there is a scientific review committee, there is a regulatory review. There are three types of review: scientific review, regulatory review, and then comes the ethical review. So scientific review and regulatory review are completed before the ethical review is done. So what is done in the scientific review? In scientific review, there is exploration whether the scientific study is novelty, its rationality, its relevance, justification for why the trial is being done, and the scientific merits of the research project, which includes the study design, the inclusion-exclusion criteria, the randomization procedure, the sample size, the outcome, the pharmacy plan, the follow-up schedule. All these are included in the scientific review. Then review of the toxicology studies, laboratory and animal data, technology transfer, and capacity building at sites. Now, whenever it is a scientifically planned research, they usually address the human subjects and ethical issues. Now, then next comes the regulatory review. That is also to be done before the ethics review is done. What does the regulatory review? It is done by the regulatory authorities. So they evaluate preclinical trials and data, especially in drugs and vaccine research trials. They assess the in-country regulatory requirements for drug vaccine import. They ensure the national requirements for special situations, the genetically engineered products, stem cell research, reproductive technology, organ transplant, etc. Then they look at the sample, whatever the requirements are related to sample shipment and transfer of raw data. There are very intellectual property right issues, and especially anything that is related, it has to be checked related to government of India, because government of India is very serious about these issues. Exchange of scientists or visitors, budget, foreign funding, whenever there is a foreign funding project is being done in India, all these things have to be looked up during the regulatory review, research in border or high security areas. Now, these scientific reviews and regulatory reviews, sometimes, they even answer many of the ethical concerns that are looked up in the ethical review. Then comes the ethical issues that need to be addressed. What are the ethical issues that need to be addressed? Whether the researchers are competent, the team is competent, whether the provision for protection of human right and ethical issue is there to look at the vulnerable population, measures for protecting confidentiality and non-discriminatory practice, then appropriateness of informed consent, mechanisms for reporting adverse events, serious adverse events, and how to manage them, care and support for research participants, long-term care, post-trial also access to care, reimbursement and compensation. This is again important. Compensation for the time lost by the participant, compensation for the travel that the participant does. So the compensation has to be looked upon by the ethics committee. And this is important because they can play a role in deciding the compensation. It has to be adequate to meet the participants' cost, but not so much that it coerces or it is inducing, it is an incentive to participate in the study. So the compensation should be adequate. Continuing review to progress of the study. So main responsibility of the institutional ethics committee, which we call in India as institutional ethics committee, they review the ethical aspects, and abroad we call it the institutional research board. Now, the responsibility is to look at, does the study have community benefit? Are the rights of participant protected? Benefit versus risk ratio, access to study findings, safety, care, and support to research participants. So after all this, we can say that ethics influences health research and practice of medicine, because day by day, there is a growing expectation about accountability from the researcher. There is questioning of government responsibility at all levels and investigators' responsibility. All these are becoming more and more accountable because of the growing public awareness due to advocacy movement. There is a collective demand for health benefits, universal right to health care, place for self-responsibility. Now, can we say that only the researcher is responsible? No, at the same time, the participant is also responsible for the ethical consideration in the study. And thus, there is a need to include bioethics in medical curriculum that is being more and more stressed upon. With this, I end the topic of ethical issues. Thank you.
Thank you so much, Arpita ma'am, for sharing your wisdom. So with this, we conclude today's lectures.